A presentation of the University of Alabama in Birmingham Dental Television System. Dental Anatomy. Mandibular, central, and lateral incisors. A telecourse by Dr. Barry Eisenberg, Dr. Wilson Wright, Jr., and Dr. Michael Hughes. Mandibular central incisor. General characteristics. The mandibular central incisors approximate each other on either side of the midline and are identified according to the universal numbering system as teeth number 24 and number 25. They are the smallest of the permanent teeth and the most constant in anatomical form. The first evidence of calcification of these teeth is between 3 and 4 months. The enamel layer is completed between the 4th and 5th year, with eruption usually occurring by years 6 or 7. The root formation usually is completed by the 9th year. It should be noted that the mandibular central incisors are normally the first succedaneous teeth to erupt, that is, the first permanent teeth to erupt which take the place of their deciduous predecessors. The labial aspect. Note that the mesial and distal outlines from the labial view converge equally toward the cervix. The mesio-incisal and disto-incisal angles are equally acute and usually quite sharp. The mesial outline shows the height of contour at the contact area in the incisal 1/3, very close to the incisal edge. The incisal outline is straight and at right angles to the long axis of the tooth, with the labial-lingual plane dividing the crown and root into equal portions. Early in eruption, 3 mamelons, or slight elevations, are present on the incisal, but usually are soon worn away due to occlusion. The distal outline is similar to the mesial, with the height of contour in the incisal 1/3. The cervical outline of the crown presents a cervical line that is symmetrically curved in a small arc toward the root portion of the tooth. The labial surface is slightly convex, both mesiodistally and incisogingivally, with a definite convexity in the gingival 1/3. 2 developmental depressions, mesiolabial and distolabial, if present at all, are faint and extend gingivally from the incisal border only about 1/3 of the length of the surface. The root surface, as can be seen, is normally single and straight. In the labial aspect, it is generally symmetrical and tapers gradually to a fairly sharp apex. From this view, it is decidedly convex. The mesial aspect. As characteristic of all incisors, the crown from this view is chiseled or wedge-shaped in outline. The labial outline forms a relatively straight line from the incisal edge to the height of contour and is then convex in the remainder of the gingival 1/3. The lingual outline, on the other hand, is S-shaped, being concave from the incisal ridge to the cingulum and then convex from the cingulum to the cervical line. The incisal outline shows the incisal ridge straight or slightly rounded and located lingual to the center of the root. After incisal wear, the mandibular incisors exhibit an incisal edge which slopes toward the labial. This is due to the pattern of occlusal wear between maxillary and mandibular incisor teeth. The cervical line from the mesial aspect shows a marked even contour incisally approximately 1/3 the length of the crown, with its highest curvature directly beneath the incisal edge. The contact area is located about halfway from labial to lingual in the incisal 1/3, very close to the incisal edge. The root outline from the mesial surface is much broader than either labial or lingual, with a small linear depression noted, causing a concavity along the root surface. The lingual aspect. There is a slight taper to the lingual, which makes the lingual surface smaller than the labial. The profile of the crown corresponds in outline to that already described for the labial aspect. The surface presents elevations known as mesial and distal marginal ridges, which normally are quite indistinct. These border the slight concavity on the lingual surface, known as the lingual fossa. The prominent elevation located cervically to the fossa is the cingulum. This makes the gingival portion of the tooth convex, both mesiodistally and incisogingivally. The lingual cervical line presents approximately the same degree of curvature as that of the labial aspect. The root outline, as from the labial view, is also decidedly convex and tapered. The distal aspect. All views of the crown portion of the tooth from this aspect are similar to the mesial surface, except the cervical line curves slightly less toward the incisal. Even the contact area has a similar location, a fact which is unique to the mandibular central incisors. That is, it is located about halfway from the labial to the lingual, in the incisal third, very close to the incisal edge. As with the mesial aspect, the root surface is broad, with a linear depression noted. Normally, it is deeper, that is, more concave than that noted on the mesial. The incisal aspect. Most notable from this view is the symmetry of the mesial and distal portions and the straight incisal edge. The tooth is roughly four-sided, or diamond-shaped, and is wider labiolingually than mesiodistally. The cingulum sometimes appears to be slightly distal to the labiolingual plane. Mandibular lateral incisor. General characteristics. The mandibular lateral incisors are the second mandibular teeth from the midline and are located distal to the mandibular central incisors and mesial to the mandibular cuspids. They are identified according to the universal numbering system as teeth number 23 and number 26. The first evidence of calcification of these teeth is between 3 and 4 months. The enamel layer is completed between the 4th and 5th year, with eruption usually occurring by years 7 to 8. The root formation is completed by the 10th year. Since the mandibular lateral incisor and the mandibular central incisor resemble each other so closely, many direct comparisons can be made. Consequently, from each aspect, only pertinent similarities and differences between the two incisors will be given. The lateral incisor is slightly larger in all respects, but otherwise resembles the central incisor very closely in form. It also complements the central in function. The labial aspect. Unlike the central incisor, there is a lack of bilateral symmetry on the lateral incisor, with the mesio-incisal angle sharp and distinct, and the disto-incisal angle rounded and more cervically situated. Mesial outline. The height of contour is in the incisal 1/3, very near the incisal edge. This area approximates the distal contact of the adjacent central incisor. Incisal outline. The incisal presents one of the more distinguishing characteristics of this tooth. The margin slopes gingivally toward the distal, with a disto-incisal angle which is more rounded than the same angle on the central incisor, as indicated by the broken line. Mamelons are usually present before incisal wear. distal outline. The slope of the incisal creates a shorter distal outline when compared to the mesial. This also causes the contact area on the distal to be more cervically located than on the mesial, thus creating a lower height of contour and giving the distal outline the appearance of greater convexity. Cervical outline. The cervical line appears the same as for the mandibular central incisor, that is, symmetrically curved in a small arc toward the root portion of the tooth. Labial surface. Except for the crown being slightly larger, the surface resembles the mandibular central incisor in all features. Root surface. The root surface, as can be seen, is normally single and straight. From this view, it is generally symmetrical and tapers gradually to a fairly sharp apex. The root form is usually larger, but otherwise similar to that of the central incisor from all aspects, including the developmental depressions. The mesial aspect. The cervical line shows less curvature and height than its counterpart on the mesial of the central incisor. There is a marked even contour of the line toward the incisal of the tooth. The contact area on the mesial, as in the central, is in the incisal 1/3. The lingual aspect. The view from this aspect reveals an outline similar to that as seen from the labial. The structures of the lingual surface, cingulum, marginal ridges, and fossa are generally not prominent, just as in the central. The distal aspect. From this aspect, the lateral's distal surface is shorter incisor-cervically than the mesial aspect. The cervical line is less curved than seen in the mesial aspect of this tooth, and also less than the distal of the central incisor. The distal contact area is more cervically located than on the mesial, having its contact dictated by the shape of the next tooth in the arch, which is the canine tooth. It is located at the junction of the incisal and middle thirds, which makes it the only mandibular incisor contact not in the incisal third. The incisal aspect. The incisal edge is not straight mesiodistally, as in the central. Rather, it curves toward the lingual in its distal portion. Also, the cingulum appears displaced toward the distal. These features give the tooth the appearance of being twisted on the root base and are the most dramatic distinguishing characteristics of the lateral incisor.